I'm Louise Yarrow from Calgary. I am a lab technologist by profession, 50 years worth. And as a board member, I had many roles before then. I was a unit rep and I held VP of Human Resources for 2 terms. And whatever else they asked me to do, I took on the job. Just the attitude of government and the way they change laws to make them work for themselves. Even the labor board sometimes I don't think has as much weight as it used to because it's involved in the government and whatnot. And so I just don't feel that we're going in the right direction for people to work. It's so easy to say, we don't need you and you're gone tomorrow. There's very few laws. I mean, we do have some, you get some severance, but sometimes it's hard to get it out of people. In healthcare, on the whole, I think we've done fairly well. If we know something's happening, we're working on it behind the scenes. Now, we didn't work on it so much in the 90s when Klein started to downsize. It was a shock to all the unions, I think, to nurses, to health sciences, and I think, and I hope that they're working really, really hard now. Not that I'm in the management level now to know what's going on, but I sure hope they're working. And even as a retired person, I send off letters to our president of health sciences. What are you guys doing on this? And they always respond, so that's always good. My favorite was when I was assigned to Public Interest Alberta on the Seniors Task Force. I've always had a fond liking to seniors, and it was when we did a sit-in when Premier Redford was in, and Horn, and the MLA, Fred Horn, wanted to bring in means testing for seniors. So we would maybe not have that $25 limit that we have. And we were enraged. And so we did a sit-in in Ford's office, or Horner's office, pardon me, and we stayed till midnight until the police came and said, you seniors have to leave. I mean, it looked like we were, tearing the place apart or something, but they had all these police officers and they escorted us off, but we saved that means testing not being put in place. That was one of my highlights for sure. Always sort of a militant type person. In anywhere that I've worked as lab, we've always been a big family. You were concerned about your coworker, and I think that really helps. You talk about it, you give support when you have a down day, and I don't know what you're going to tell the people today because it's going to be very difficult to find a position here in Alberta. I'm sure it's just like what I heard last night when I was out, and it wasn't lab, but it's going to happen. It was a nurse that was serving this group of people in a restaurant, and she said, this is the best job I've had. I'm leaving nursing. I cannot do it anymore. And that's what's going to happen to the lab and all the other disciplines in hospitals and healthcare, because we're not being appreciated, not appreciated one bit.